What are your thoughts on honey and fruit on the carnivore diet?
So full disclosure, I love fruit and I love honey. Honey and coffee, yes. But I fatten very easily and I develop type 2 diabetes very easily. And if I enjoyed as much fruit as I just wanted to, and I put as much honey in my coffee as I wanted to, in just a few months, I would gain 20, 30, 40 pounds and I would be pre-diabetic again. Because fruit and honey are full of not just fructose. This is a common misconception that you'll hear seemingly very knowledgeable people repeating. Honey is not just fructose. It also contains sucrose and glucose. All fruits, without exception, they have lots of fructose, no doubt, but they also contain sucrose and glucose. They are going to raise your hemoglobin A1C to some degree. Now, because they're so high in fructose, you're going to be causing glycation to your tissues and cells. But now here's the clincher. A hemoglobin A1C test, it checks you for glycation, but it only checks for glucose glycation. The way the test is designed is to look for glucose that is connected to lysine or another amino acid. That's what the test specifically looks for. Okay, this is very important. So you can have severe fructose glycation, also called fructation, that is invisible to the hemoglobin A1C test, also invisible to the fructosamine test. Even though it has fructoso in the name, it still checks for glucose amino acid bonds. That's what it checks for. The same goes for galactose. For people who love raw milk and think that raw milk is carnivore, galactose is 10 times more glycating than glucose. Fructose is 7 to 10 times more glycating than glucose is. Number one, and number two, you cannot detect it with any test that your doctor can order in their lab or in their office. And so you're causing lots of glycation that will not show up on your hemoglobin A1C. And so also the sugar is going to raise your blood sugar. There's no ifs, ands, or buts. That's going to raise your insulin. That's going to lead to all the problems that hyperinsulinemia is connected to. So, you know, if you want to do an animal-based diet with fruit and honey, I would say try it for 90 days. See how you feel, see how it's going, see what your blue genes say, right? See what your performance says. How are you sleeping? How's your mood? And at the end of that 90 days, I think that most of you will decide, yeah, I love fruit and honey, but that probably should not be part of my daily diet.
What stood out to me is raw milk, when you mentioned raw milk. So that could also be problematic, huh?
100%. Now, let me say, I'm not anti-raw milk. If you're going to drink milk, I think the least bad milk you can drink is whole raw milk.
Raw milk, yeah.
Whole raw milk. I think that's the least bad of all the milk options out there. Whole raw goat's milk, I think, is the ultimate least bad for human beings. That's hard to find, but it's just because it's raw, a lot of people think it's magical, but it's still full of lactose. Lactose breaks down into glucose and galactose. Glucose glycates, we can detect that, but galactose glycates 10 times more, and you cannot detect it. Milk is literally made for mammals as babies to grow and gain weight as quickly as they possibly can. That is what milk is made for. So if you're watching this and you're under the age of 5, it's totally fine to drink raw, whole milk. You may need goat milk like Beckett Berry. He drinks milk every day. But when he gets 5, 6, or 7, we'll start to wean that out because he's going to lose his lactase ability, more than likely, at least to some degree. And he's also going to become more sensitive to the caseins and the whey in the milk. Milk is for babies. I'm sorry. I hope that doesn't hurt anybody's feelings, but that's the truth of the matter.